I'm Brendan Cronin, one of the corneal specialists at the Queensland Eye Institute. I'm one of the ophthalmologists like the other doctors, but I specialise in diseases at the front of the eye such as keratoconus. So what is keratoconus? Keratoconus is a disease where the cornea, which is the clear window at the front of the eye, is weaker than it should be. The cornea looks coloured to people when they look at you straight on, but the colouring is the iris or the pupil inside the eye, and the cornea is the clear window in front of it. So think of the iris as the curtains and the cornea as the window in front of it. Your cornea should be nice and strong to keep a nice regular shape like a soccer ball. In keratoconus, for some reason the cornea is weak, and there are lots of contributing factors to that, such as genetic diseases and allergy. And in some patients, that weakness causes the cornea to become warped or deformed, meaning that your vision is also abnormal and reduced. So there's lots of treatments that we can do for that, but we need to try and get the disease as early as we can. We're very lucky in Australia. Optometrists are highly skilled, have excellent equipment, and so a lot of keratoconus in Australia is really picked up very early, and so we have a lot of treatment options available to us. Keratoconus itself doesn't really cause blindness. It can cause your cornea to become extremely distorted and your vision to be very bad, but there are always treatments for that. And our aim with getting the disease as early as we can, and treating it as early as we can, is to make the treatments as simple as possible and your vision as good as we can possibly make it, with as little hassle to you. So keratoconus itself shouldn't really cause blindness. Left untreated, it could leave you really bad vision, but we always have treatment options available to us. So what are the treatments for keratoconus? Traditionally, we really only had two options, the first of which were hard contact lenses, and many years ago these were uncomfortable and difficult to fit in patients with bad keratoconus. Thankfully, these days contact lens technology is amazing. We can really have contact lens fitted over very steep and distorted corneas in severe keratoconus, giving patients excellent vision. We have specialist contact lens practitioners, optometrists who really specialise in this kind of work in Queensland and Australia, who are excellent at fitting patients with severe keratoconus with excellent and comfortable contact lenses for good vision. Then traditionally, our only other treatment was a corneal transplant. Thankfully, we have lots of other treatments now to avoid transplants, but a transplant really involved us having to cut your cornea off and then stitch on a donor cornea from someone who's passed away and donated their eyes for us to use. Whilst this was an excellent treatment for patients and still is required in some patients, there are a lot of complications associated with transplants, and it's a treatment we try to avoid. So these days, thankfully, we have a lot of other options available to us, both to stop keratoconus from getting worse and to improve your vision in keratoconus, to sometimes avoid contact lenses and almost always avoid corneal transplants. The data really shows these days that the number of transplants being performed in Australia for keratoconus is reducing enormously because of the new technology and treatments we have available. The two mainstays of modern treatment for keratoconus are controlling a patient's allergy and eye rubbing, and then collagen cross-linking. So we know that patients with keratoconus can exacerbate the acceleration of their disease by rubbing their eyes and by having untreated ocular allergy. So it's really important that we reinforce to patients that they can't rub their eyes and that they work with their optometrist or ophthalmologist to control their ocular allergies. The second treatment is called corneal collagen cross-linking. This was developed in Germany over 20 years ago, and it involves us soaking the eye or the cornea in vitamin B, or riboflavin, which is a yellow B group vitamin, and then applying an ultraviolet light to the cornea. And the vitamin B and the ultraviolet light interact in the cornea to cause what we call collagen cross-linking bonds. And these are little chemical bonds that make the cornea much stiffer, much more rigid, and it slows or almost always stops the progression of keratoconus. That treatment has been taken to a whole nother level here at the Queensland Eye Institute. We're really proud to be able to offer this to our patients. We have Australia's only topography-guided corneal cross-linker. And so that means we take a map of the shape of your cornea and plug that map into the cross-linking machine, and we deliver more energy to the steeper parts of the cornea and less energy to the less steep parts of the cornea, so we can not only try and stop the disease, but even improve the shape of your cornea and try and improve your vision with the cross-linking procedure. So traditional cross-linking should stabilise or stop the progression of keratoconus, but modern topography-guided cross-linking can also improve the shape of your cornea and improve your vision. So whilst cross-linking is the mainstay of treatment for stabilising keratoconus, We can also take it to the next level, not only with topography-guided cross-linking, but also topography-guided laser treatments. We're really proud to be able to say that the hospital we operate in here, the South Bank Day Hospital, is the only hospital-based eczema laser in Queensland. So what that means is, a little bit like the topography-guided cross-linking machine, we can plug a map of the shape of your eye into the laser and try and regularise the shape of your cornea. The laser is extremely accurate and will just ablate or laser away tiny amounts of your cornea to try and restore that shape from being a little bit more like a rugby ball into a little bit more like a soccer ball. So just lasering away a little bit of that irregularity in keratoconus. The aim of this treatment isn't to get you out of glasses at all. The aim of the treatment is generally to get you into glasses. So sometimes patients who would otherwise need a contact lens, they may be intolerant of contact lenses sometimes, we can put them under the laser. The laser may take away some of the irregularity that their keratoconus has caused, and then we'll perform the collagen cross-linking procedure at the same time to strengthen the cornea as well. So there's lots of treatment options available for keratoconus patients these days. There are certainly other treatments for keratoconus, but they're very nuanced and need to be discussed with your ophthalmologist in a consultation when they have access to all of the appropriate scans and information about your eye. Thank you very much for watching. I hope this taught you a little bit about keratoconus and the treatments available.